everyone. Welcome to our podcast called Speech Beyond Words. My name is Ashley, and I have a very dear friend here with me.
Hi, my name is Justine.
And this is our podcast. I'm so excited to have you here. I feel like I haven't gotten the chance to speak with you in a really long time. How are you?
I'm good. I know this has been such a busy week with all of our finals and just wrapping up our first year of graduate school. Like, I can't believe that a year passed. That's
I
crazy.
know, we're almost there. So exciting.
One more year and then we will be SLPs.
Oh, yeah. And speaking of SLPs, we find a lot of joy in just anything that is speech related. So we're here, and thank you for tuning in on this episode this week.
Yeah, so this is a very special episode, I think, because we're really going to be talking about the false information in the media, especially regarding celebrities like Emilia Clarke, who starred in Game of Thrones, the famous actor that we all love, Bruce Willis, and of course, the very popular talk show host, Wendy Williams. We know she's always spilling the tea, who basically have come forward recently to share their diagnoses of aphasia. So, we're currently in graduate school studying speech language pathology, and I think this is a perfect time to share what we have been learning to the audience today, and we hope we can clear up any inaccuracies that have been mentioned in mainstream media reports.
Yes. And I think it's so important that we made the connection of people that are famous and well known that are going through this, because it's something that is recurring, and it just is very impactful when you're able to make that connection with somebody.
Yeah. I think it's also important that, we spread the awareness, because it could be a family member, someone who is close to you, or, and just the warning signs of some of the things to look out for, which we'll talk about a little later, could, potentially save a life or just give you more information on how to work with someone who has aphasia.
Yes, most definitely. So why don't we just dive right in and get started?
Yes, that's perfect.
Amazing. So our first question is, what is aphasia? Aphasia is a condition caused by damage to parts of the brain, and it affects the control of language, and this usually happens after language is established. This damage can make it hard for someone to speak, understand either speech, their reading or writing, and it affects their ability to communicate, and it can impact their social interactions and quality of life, as well as the lives of their family and caregivers.
Yes, thank you so much for that information. Actually, I think it's also important to explain what aphasia is not, and I think that goes back to some of the narratives that have been spreading in the media. So some people mistakenly believe that aphasia is a sign of an intellectual disability, and that's actually not true. Aphasia is the loss of language, not intellect. And it's also not related to sensory or motor deficits, which you may see when someone is producing speech with aphasia. You might think that they are presenting with like a motor difficulty, but it's just the loss of language. A motor difficulty can come with aphasia, but that's not specifically aphasia. And it's also not a psychiatric disorder. So these are some of the things that aphasia is not.
Yes, I loved how you mentioned that, because a lot of people do believe that it's related to intellect. So thank you.
Yeah. So, okay, so now that we spoke about like what aphasia is, I think something that's relatable for our audience is to kind of like how is it caused? So yesterday we sent out a request for questions to our subscribers, and of course, many of them wanted to learn about what causes aphasia. So we're going to touch on that now. We think that this will be important for our viewers to know, like I said, so that you guys can be aware of some important warning signs to look out for. So what causes aphasia? So aphasia can be caused by several factors. We'll pretty much get into the main factors, which is first, aphasia can be caused by a TBI, which stands for a traumatic brain injury. So unfortunately, TBIs are very common and can result from everyday accidents, like falls. We'll see that a lot with like little kids who are just, falling as they're learning to walk. Car accidents, we'll see more with people who are driving. Sports injuries, combat injuries, so people who are in the military, and unfortunately incidents of violence, such as gun violence. So there are two different types of TBIs that we'll talk about today, which is first a closed brain injury, which basically could come from like a blunt impact, something that's non-penetrating. So this is more of your falls, where you're hitting your head, car accident. And then also we have penetrating brain injuries. So this is really scary. So this is when an object enters the brain or penetrates the brain. So that could be a bullet, which is scary, and we've also seen examples of a pole. We've seen poles enter the brain. So the severity of TBIs vary, and brain damage can be temporary, which we hope for, or result in long-term effects, which could then produce aphasia and a lot of other difficulties.
Yes. I also wanted to touch base on the other cause, which is a stroke. There are two main categories of strokes. You can either have an ischemic stroke or a hemorrhagic stroke. An ischemic stroke occurs when blood flow to the brain is blocked, often due to built up like plaque or fatty substances. This is the most common type of stroke. The other type of stroke is a hemorrhagic stroke. This type of stroke can occur when a blood vessel ruptures. Many of you have heard of an aneurysm, which is a type of hemorrhagic stroke. Unfortunately, while hemorrhagic strokes are less common, they are often more fatal. So now that we know this, there's some common symptoms. They can appear suddenly or develop over several months. And I think it's important to let you all know some signs to look out for, as this could potentially save a life. And when it comes to stroke, you want to intervene as fast as possible to minimize the damage to the brain. So some signs to be aware of include loss of balance, headache or dizziness, blurred vision, face drooping, arm, leg weakness, and speech difficulty. So if you notice any of these signs, please call 911 immediately and seek medical attention.
Yeah, so this was actually so interesting. This semester or in graduate school, we learned that the brain works contralaterally. So as far as, for example, arm and leg weakness, we learned something that maybe can help you guys. So basically, let's say you're having a stroke and you have weakness on your left side. The site or the area that is affected is most likely on the right side of your brain. And if you have right side weakness, then that would be the left side of the brain that's affected. So that was something that was really interesting to learn about. But another way that someone can acquire aphasia is through neurodegenerative diseases such as dementia, Alzheimer's disease, and Parkinson's So this was interesting because I loved Wendy Williams. Like, Wendy Williams was actually, like we spoke about earlier, diagnosed with aphasia. So her type of aphasia is primary progressive aphasia, which is a type of aphasia that is associated with frontal temporal dementia. So this is basically where your brain is essentially breaking down, let's say, and parts of your brain are thinning. And so it is progressive, meaning that this type of disease gets worse over time. So her prognosis doesn't look very good. So unlike other aphasias, this one has a really, I guess, the hopes are not as hopeful as, I guess, the other types of aphasia. So yeah.
Wow, I used to be a big fan of hers, but with grad school, I really haven't been able to keep up with much. And I did not know that she was diagnosed with primary progressive aphasia. That's so sad. Well, thank you for that information and the background knowledge. It's nice to have a refresher on things to look out for. And identifying and taking action with the stroke is crucial when speaking about aphasia and the lasting effects that it might have on an individual. So speaking of, I wanted to touch on different characteristic individuals with aphasia might have. A little backstory. So I recently volunteered and I heard a worker talk about one of their clients, and I was so surprised by what I heard. The worker said, oh, they don't have aphasia. My grandmother has aphasia and they speak a lot more than they can. So I was kind of reflecting on this and it really broke my heart, but it was a really eye-opening experience because I realized that not everyone might know that there are different types of aphasia and that aphasia will look different for everyone.
Yeah, I think that's another reason why we love our podcast, so that we could get this information out. I think even in my family, it's been nice kind of explaining to them all that I'm learning in school. I think that even though we're learning about speech and language, that I think it's nice to just kind of be able to explain this to people and get the awareness out. So there are many different types of aphasia, and I guess I would love to give it a little overview of how SLPs can determine the type of aphasia that is present in an individual. So SLPs look at many characteristics that an individual is presenting with to help basically classify the type of aphasia that they have. So basically at the top of the pyramid, we would look at if the client is fluent or non-fluent. So these are two categories that we would look at. So a fluent aphasia is characterized by a longer utterance length, a normal rate of speech, as well as a normal prosody and intonation that will be intact. At times, these individuals will have empty speech, unfortunately, meaning that the words that are coming out may hold no meaning. So on the other spectrum, we have non-fluent aphasia, which is characterized by shorter utterance length, which a speech language pathologist sometimes call telegraphic speech, and their speech will be slower and more effortful compared to fluent aphasia. And then under this category of non-fluent and fluent, and once we have identified if it is fluent or non-fluent, these categories can be broken down even further into poor comprehension or good comprehension. So a good comprehension means that the individual or the client knows what is being asked of them and can respond accordingly. And then poor comprehension means that obviously they're having difficulty understanding the task, and I would say as it gets more on the surface level, they might get it, but as you get more As the questions get more complex, that's where you'll really get to see the comprehension breakdowns. And then under the fluent and then the comprehension, we will assess the repetition of a client. So that could be, for example, having them repeat after us. So my name is Justine, and then if they can repeat my name is Justine. That's basically what repetition is, them being able to repeat. So these subcategories essentially help the SLP as well as the medical team working with the person with aphasia alongside other assessments, which we will touch on in a little bit. So the differential diagnosis of what type of aphasia this person has, along with also sometimes, if it's available, any type of neuroimaging will help to see where the lesion is and what areas of the brain are around that lesion. So the classification chart, like we just talked about, and also the assessments, which we will talk about in a little bit.
Yes, thank you so much, Justine, for that little breakdown.
Yeah.
Now that we know how the SLP mind works to categorize these aphasias, I want to touch base on some symptoms that may be present with those individuals with aphasia. So there was this post that I recently saw stating that aphasia only affects verbal communication, and I would like to debunk that myth and touch base on the symptoms that are present with people with aphasia. So the first is their verbal expression. People who have aphasia will either have short utterances or have an effect on either the content or function words that they're using. So we'll dive in on a little bit more of the symptoms. We have agrammatism, which is difficulty with grammar, syntax, and word order. The individual may present with perseverations, which is repeated words or phrases that they just repeat nonstop. Neologisms are non-words. For example, a person that's talking about an animal all of a sudden says sheaves, which is a fake animal or fake word, a made-up word, but they sound like real words, and the person thinks that they're saying a real word. Next, circumlocution, which is dancing around a word or a concept or a topic that you would like to say. So the word really isn't there, and that kind of goes hand in hand with anomia, which is word finding difficulties. It is that feeling that you have that the word is at the tip of the tongue, and I know many people who don't have aphasia can relate to this, but you know the word, but you just can't get it out. So next, I would like to talk about paraphasias. The first being semantic paraphasias, which is using a word that's related to your target word. So for example, if your target word is banana, the individual would say apple instead. So it is in the same category of fruits, but it's not exactly the fruit that they were looking to say. We also have phonemic paraphasias, which is switching out one or more sounds in a word. So for example, the word table, you might say as cable, or going, you might say as bowing. And then the last that I want to touch upon is jargon, which is a stream of vocalizations without any real words. These streams tend to have a conversational inflection. However, they do not hold any meaning. So this is in the verbal aspect. I would like to touch base on the written expression that can also be affected. So written language is just as important as verbal language. Written will be affected in some individuals with aphasia, either the linguistic component or the motor component, and abilities can be affected in individuals with aphasia. When these are affected, it causes agraphia. And then they might show or present with difficulties with writing irregular words, phoneme to grapheme conversions, which is the sound to the letter conversion, and letter formation. Reading can also be impacted. It is an acquired reading and comprehension impairment. Some difficulties that can be present are reading irregular words, difficulties with the first or last letter of words, and lexical and non-lexical reading.
Ashley, thank you so much for that. I know that might be a lot for our audience, but that really just shows just how complex aphasia truly is. One client may present with some of these, and then the next client that you see might have a different presentation of their symptoms. And it's hard, but that was amazing. And I think I also saw the same post, and I was reading the comments, and someone replied that recovery from aphasia is a quick one, that a person with aphasia will go back to their old selves within a week. So I kind of wanted to touch base on what does recovery look like? And I think recovery looks different for every person, depending on so many different aspects. So I wanted to touch base on some scientific research that I was reading on the ASHA website, which stands for American Speech, Language, and Hearing Association, which I highly recommend for anyone listening to check out. They have a wealth of information on everything related to speech and language, if that's something that you're interested in. And they mentioned that recovery can look different, like I said, for every individual. So it's important to keep in mind with aphasia that the lesion site, or where the damage is in the brain, and the size of the lesion play a role in recovery. So at first, most of the recovery that a person with aphasia has will be spontaneous recovery due to just how miraculous our brains are. And a lot of that is due to the neuroplasticity and its ability to essentially repair on its own. So neuroplasticity, is the potential of the neural system to recover from nervous system damage. So it's just our body's wonderful job of, like I said, repairing itself. And neuroplasticity is a response to stimulation and activation of different regions of the brain. So this spontaneous recovery can take up to 3 months. So a lot can change in the first 3 months of someone who just had a stroke or just had a TBI. And spontaneous recovery does not mean that the individual will go back to who they were before their injury. So I think that's also something important to mention, especially for those who work with, the caregivers and the family members of those who have been affected by aphasia, and just letting them know that we don't know what the final outcome is, but we are trying our best, and there's a lot of recovery that's happening on its own. So a good baseline is to start basically with the spontaneous recovery and how to best support our clients as they make it through this stage.
Yes, definitely. And I really liked how you mentioned how spontaneous recovery lasts up to 3 months. I think it just paints a picture for how long recovery takes. And that's just for the spontaneous recovery. So recovery happens throughout a really long time. So that comment with just a week is not true. But I do want to give some recommendations for the family members that might have somebody that's going through a person that just had a stroke and was diagnosed with aphasia. It is a big change for the family and the person with aphasia. So I kind of want to give some advice to the family members. I think it's an important question on how to best support them. And I think the most important piece of advice is to be patient. They just had and went through an event that has changed their whole life. Their feelings and thinking are still intact, and they're still trying to navigate and get accustomed to this new life. During this big adjustment, many feelings will be going through them and the family as well. So just being understanding and show compassion, I feel like goes a really long way. I also think finding different ways to communicate can be very helpful. Instead of solely relying on verbal communication, verbal communication is one of the area that was most impacted. So whether it's by using gestures or writing or pictures or drawing, just finding different methods of communication may help facilitate communication and help navigate this time and make it a little bit easier for both the person with aphasia and the family members.
Yes, I agree. All kinds of communication are welcomed, especially to facilitate communication during this time. So I'm sure our audience probably wants to know, how can aphasia be assessed? So that's what we'll cover now. So before we dive into the specifics of assessment, which we'll briefly touch on, it's important to understand that the goal behind the assessments, especially if you have someone in your life with aphasia. Knowing these goals is key to providing the best support. So rather than focusing on what a person with aphasia can or cannot do, the goals aim to identify what they need and what they want to do going forward. This shift in focus helps us to later develop person-centered functional goals that are meaningful for both the individual and their family. So by closing the gap, we can create more effective and personalized support strategies that enhance their quality of life. And that's essentially what we're here for. This approach makes the assessment process more person-centered, ensuring that the needs and desires of our clients are at the forefront of our care. So some assessments that help SLPs to assess functional communication are the popular Western Aphasia Battery, which is REVISE, the WAB, the WAB, which assesses a spoken language function. So this is your standardized test that is going to help with naming, fluency, and comprehension, and other communicative aspects. And we can also use non-standardized assessments in this process, for example, for reading comprehension, which can also be affected by aphasia, which we spoke about earlier. Another big part of assessment is done through interviews, which are extremely helpful, either with the client if they are capable, or their family. This can help us assess the client's participation in activities, so their participation in activities outside the home, social interactions, are they communicating their needs at home, as well as environmental and personal factors. So like, what are any other health conditions that they may have, what are their family and friend support, what is their motivation at that, are they motivated at that point? So some other assessments are the assessment for living with aphasia, which helps us to assess participation, like I just talked about, in everyday activities, and then the communication confidence rating scale, which can assess the other portion, which is the person's environmental and personal factors that might interfere with their communication. So for the past few weeks, Ashley and I have been learning about different treatment approaches for aphasia, which has been really interesting. Our classmates gave some excellent presentations, and we have actually learned so much. We wanted to end the podcast by sharing two different approaches that stood out to us. For me, one approach that we learned about is called the goal, plan, do, review, and revise, which is a mouthful, or GPDRR. And this treatment is designed for post-stroke and TBI patients, and it helps to restore cognitive functions by using strategies to compensate for any impaired functions. So this treatment technique draws on the work of many people, too many to list, but neuropsychologists, neuroscientists, ABA specialists, educational psychologists, and SLPs all had a hand in creating this treatment approach. And what I love about this approach is that it helps clinicians and clients break down meaningful functional goals kind of into manageable steps. So, for example, tasks like calling family members, which we learned about in class, or even identifying your healthcare providers. And how they do it is they simplify and organize this task into clear steps. So, one aspect I find helpful is the worksheet that is included in this approach. And it details each step, making the process transparent and easy to follow for both the clinician and the client. And we love something that's easy to follow. So it's also a great tool, I think, the worksheet, for tracking progress, because it ensures that the steps are reviewed and revised as needed. And this type of activity not only helps in achieving the client's goal, but I'm pretty sure it can also make a client feel a sense of accomplishment because you're revising until you are able to complete the goal. So that was one treatment approach that I thought that was really cool.
Yes, I agree. I'm very into the rehabilitation process of individuals with aphasia. So I'm very passionate about getting them back to their independent life after a stroke, or at least as close as I possibly can. One intervention that I was really interested in is the script training by Holland, Millman, and Bays. This was created in 2002. It is a holistic approach to language processing and helps clients integrate back to daily life activities through functional and meaningful communication. It is used for individuals past the point of spontaneous recovery that are in stable range in their progress. The main idea is that the client and clinician will come up with a script for their client to use in their daily life. For example, ordering at a restaurant or ordering some coffee. This intervention being that the script in the template is takes conversational turns and sentences that are appropriate for the client. In the beginning, the client will be asked to listen to the script and then repeat the script. Next, they will be asked to read it out loud and then produce the script from memory. What I really like is that we can support our clients with visual cue cards, and we will practice this script throughout the session as it becomes almost automatic for the patient. As the process becomes easier for the client, more sentences can be added to make it more conversational-like. And it is crucial for the client to practice outside of the sessions to carry over the strategies into everyday life. Not only does script training help with activities targeted, but it's also evidence-based that it will help overall language, and it can be used with monolingual and bilingual clients, which I'm very passionate about. So I think this covers what we were going to talk about during our podcast. I think it was a lot of helpful and great information.
Yes, I just want to thank you for having me, and also want to send a thank you to Professor Newmeyer, who has given us so much great information. And I think even doing this podcast, I feel a lot more prepared because of her. So thank you, Professor Newmeyer. If you hear this, thank you so much. And I think that's it. I think we're out of time.
Yeah, if you would like to review any of our references, they will be linked in the description box. I hope you really enjoyed this podcast. Thank you, Justine, for coming on and being part of Speech Beyond Words.
Yes, thank you for having me.